Coming up on American Medicine Today, roughly 70% of Americans have unbalanced cortisol levels, resulting in thousands of terminal ailments. Wibe Wagemans joins us to discuss how we can manage our cortisol levels in healthy ways. Next, Jeremy was a fitness trainer turned videographer who started experiencing extreme back pain that prevented him from working. See how the patented Bonati spine procedures got Jeremy back up and working pain-free. Finally, Dr. Bonati discusses using regenerative medicine in the future to replace organ donation. Learn about the tools we already have in place that could help us grow our own parts. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Euchre. Now, an estimated 70% of U.S. adults have unbalanced cortisol, resulting in thousands of ailments, including heart disease and early death. So how do we manage our cortisol levels in the healthiest ways? Joining us to discuss is Wibe Wagemans, founder of Paradigm Inc. and co-author of the new book, Cortisol, the Master Hormone. Welcome to the show.
Thank you, Kim.
Now, first off, tell us what cortisol is and what really made you want to write a book about it.
Yeah, cortisol is a hormone, and hormones signal stuff in our body. Cortisol happens to be the master. We found out later. It started out with a family member, and I spoke to her psychiatrist, and I asked a simple question: how do you quantify stress? And the answer was, well, we asked the patient how they feel. So they didn't sit well with me. I asked a friend of mine who's an internist, and he said, well, cortisol is the gold standard of stress, but it's not just a stress hormone. That's only 3% of what cortisol does. So if that's the case, why the heck are you guys not testing it with millions of people? And he said, it's almost impossible to test today. So that got me on this road. And long story short, I last year had a breakthrough where we basically reverse engineered the capabilities of a lab scanner, which is why you have to send these tests in. And we managed to do that and do the reading on your mobile phone and get an instant result. And that changes the whole game, not just for cortisol, but also for other hormones and other biomarkers in the future.
Why is cortisol called the master hormone first? Secondly, what causes levels to be high? I'm assuming it's a stress hormone, so anything stressful, which is pretty much everything these days. And, why don't standard, blood tests or blood measurements pick up on elevated levels like that?
Yeah, to start with the last one, you need really 5 tests during the first day. You don't have to do it 5 times a day afterwards anymore, but you need to establish your baseline. And the first measurement needs to happen when you wake up. Cortisol is your natural breakfast. It pushes glucose into the bloodstream. The reason why it's your master hormone is because cortisol is overriding every biological process in your body, whether it's your sex hormones, your metabolism, your blood pressure, list goes on and on, autoimmune diseases, list goes on. The interesting thing about cortisol, which is why we were asking ourselves, should we really do cortisol? Because people know it as a stress hormone. But it turned out that it's affecting everything. It's affecting our fertility. It's affecting, like you mentioned, cardiovascular disease. It's actually a bigger risk to cardiovascular disease and early death than smoking or obesity. So there's a lot of stuff that we uncovered, and we said, okay, let's write a book about this, because apart from the scientific community, where there's over 1 million papers have been peer reviewed, so it's very well known in the scientific community. Never made it to the clinics because it's so hard to measure. And the general audience has no idea what's going on. To your other question of what is happening with cortisol, when you have a stress response, whether it's somebody yelling at you, or you're stuck in traffic, or you're getting heckled on social media these days, what happens is usually your adrenaline kicks in first. That's in a matter of seconds. Cortisol follows a few minutes later. Halftime of adrenaline is a few minutes. cortisol is 66 minutes. After 66 minutes, it would come down and it would be totally healthy. I mean, cortisol is a lifesaver, right? That's why it evolved that way. And we use it. It's a very beneficial hormone.
Seems like in this day and age, there's just constant stressors everywhere.
Yes.
And it's like inescapable. So, I mean, what are, well, first, let me ask you this. You talk about some misconceptions about cortisol in the book. Can you give us at least a couple of those?
Yeah, for sure. So people, let's look at femtech. So you look at infertility, menopause, and even most of the OBGYNs today think that they need to measure estrogen and progesterone levels. But it turns out that it's cortisol that's inhibiting estrogen and progesterone and making these symptoms worse. One of the most important studies that we pull out in the book is by Sarah Berger, professor at the University of Buffalo, who says, we've done studies, we've established the causal effect of a 20% cortisol increase, and it basically shows that any woman would stop ovulating. Most gynecologists will say, well, try another 6 months, and then we'll try to bypass your stress levels. So that's one example. It's really that cortisol stays elevated for days, weeks, years on end, and that wreaks havoc. It's pretty much everything. And we've known that for COVID, for example. Now it's being established. One of the other findings that was published by an immunology team at Yale in August is that cortisol is most likely the only biomarker and the biomarker to diagnose long COVID.
I see all the time as I'm watching TV, all these commercials talking about supplements that will help reduce cortisol. Is that just fake news?
Fake news.
Yeah, it's mostly snake oil. It's mostly snake oil. There's no scientific consensus on any of them except for two. One is ashwagandha from North India. The other one is catechin from Japan, which is a green tea component.
The book also talks about how people who are hoping to lose weight can never achieve or will never achieve, I guess, long-term weight loss unless they're able to balance their cortisol levels. Is that accurate?
Yeah, it blew my mind. For overweight and diabetes, the number one biomarker is insulin, right? I would not dismiss insulin at all, but it's really this interplay of insulin and cortisol. Cortisol pushes glucose into the bloodstream, pretty much also from cortisone stored in fat cells around your organs. That's what a lot of us are suffering from. But then insulin has to push it out of your bloodstream, and that's where we get insulin resistance, which then turns into diabetes for millions of people.
And so how do we bring the cortisol levels down lower so that we can manage that and, keep weight off and be our healthy selves?
Yeah. Well, a lot of it is nutrition. And if you go through you put your cortisol goggles on, you look at nutrition in a completely different way. The other one is what they call hermetic stress. So you actually introduce a stressor like a sauna or a cold shower because your stress levels will drop. Your cortisol levels will actually drop deeper afterwards. It will go up first. Another example is, breathing techniques, doing sports and workouts at the right time, at the right intensity level. Like, are you going to do them in early morning or are you going to do them in the evening? Skipping breakfast, we would actually advocate that for most people to at least try it. Not if you are diagnosed with anything. We would obviously ask you to consult with your physician. But those are things to try out.
I do that anyways. I'm just a coffee head all morning long, and then all of a sudden I'm like, I've been up for 10 hours and I haven't eaten yet. So
if you do have cortisol issues, we would advise you to push out your coffee by 30 to 60 minutes after wake up. The reason is you're prolonging your cortisol pump.
I can't do that, sir. All right.
You might not have any cortisol issues, but you do want to drop off. You do want to drop off on your caffeine in the late afternoon, evening.
Tell us about this app that Paradigm Inc. has developed. Is it out? Is it available? And very quickly, kind of what it does and how people can find out more.
Yeah, we're still in beta, so it will be commercialized next year. But we've made that technological breakthrough that we can measure your cortisol levels. That was the big thing. Now it's a matter of execution.
And so it's not a blood test.
No, it's 3 drops of saliva in a rapid test, similar to your COVID test, basically.
Disregard those commercials that talk about taking a supplement to then lower cortisol levels. Thank you for being on the program, Wibe Wagemans, founder of Paradigm Inc. and co-author of the new book, Cortisol, the Master Hormone. Thanks for being on the show.
Thanks for having me.
Make sure you stay tuned. Coming up after the break, a story of recovery.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect 98.75% patient satisfaction. 70,000 procedures have been performed exclusively at our location. Nearly half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
I'm Jeremy Barnett and I live in Fort Myers, Florida. Been here just over 40 years. For over the last 30 years, I was a fitness trainer. I owned my own gym. I also did post-injury fitness rehabilitation. And about 4 years ago, I retired, sold the gym, and during that time took on video production and editing. I think that's where my back issues began, was just constantly sitting in front of a computer for so many hours, and my core got weaker, my hips and back got weaker.
We sat down with Jeremy at his home to learn more about his pain and what brought him to the Bonati Spine Institute.
Almost a year ago, when I was doing a motorcycle ride, it was about 200 miles. When I got back, I tried to take off my boots, put them down on the ground. When I tried to get back up, my whole back locked up. From that point on till my surgery, it just progressively got worse and worse and worse. After the motorcycle, it hurt for probably about 2 or 3 weeks, and I knew something was wrong. And then it started to get a little better over time. I'd have aches and pains, every few days or so, but it wasn't, debilitating. I think it was probably about 2 months prior to seeing Bonati. I was on the stairs and my cat was down there. I was trying to pick up the cat, and that's when my whole back just let out. So I'm not sure what happened, but it literally dropped me to my knees. I couldn't get up, I couldn't stand, couldn't walk, and basically crawled up the stairs, crawled to my room, just kind of laid in the bed, and that was it. It was pretty painful after that, and for 2 months straight, basically couldn't bend down to pick things up. Just doing basic household activities was nearly impossible.
Like countless others with lumbar spine issues, his discomfort radiated into the lower body, affecting his personal life as well as his career.
It went from my right hip down the back of my leg through my hamstrings down to my feet, and occasionally I'd feel it in my toes, like numbness and tingling in my toes. As a video editor and then also doing video production, I have a lot of gear that I have to carry with me. Some of it's anywhere from like 20 pounds to 50 plus pounds, so that was nearly impossible. So I had a walker that had wheels, so what I would try to do is load my gear on top of that and just kind of push it along, get it to the car, kind of try to get it in the car as best I could. And I mean, it was pretty painful and excruciating through the days just trying to get through them. And there were a few jobs that I had to decline and turn down just because I couldn't physically do them.
Jeremy tried a number of conservative treatments prior to surgery, but was ultimately met with the realization something more had to be done.
Literally anything, I could get my hands on just to try to numb the pain and, just make it through a day. Ibuprofen, Tylenol. So I was doing that. Ice packs I would use a lot, taking a lot of showers, just trying to get my body to relax. I would do some light stretching. I mean, I was really limited on what I could do, especially trying to get down to the floor to lay down and then trying to get back up was nearly impossible. I actually had a chiropractor friend that I worked for years ago. I did post-injury fitness rehabilitation for him, so I really trusted him and his judgment, and I had him try to do some chiropractic therapy. We did massage therapy, we did E-stim. So I mean, we tried a few different things, but it just wasn't working and wasn't getting any better. So he was nice enough to at least be honest with me. He told me, he said, there's not much else we can do at this point. Go get an MRI. Let's see what's going on. So I had the MRI, came back. He looked over it and definitely saw that there was a herniation. So he said, you need to, find a professional that can, maybe do some surgery and take care of it.
Finally, he took to the internet to do some research.
I was looking online through Google, doing searches for doctors in the area, and couldn't really find anybody local here in Fort Myers that I really felt comfortable with. And just happened to be on Facebook looking through, and I saw an ad, and I saw a guy probably close to my age and pretty in shape. And he was lifting weights and doing pretty much all the stuff that I did when I was in the gym, and saw that he actually went through it, made it through the other side, and was back in the gym doing exactly what he loved to do. So that kind of got me hooked on talking to the Bonati Spine Institute, called them up, and kind of took it from there. I actually spoke to a surgeon, and they talked to me, asked me about my MRIs and kind of what treatments I had tried prior to thinking about surgery. And then they said, you know, definitely come in and see us.
In March 2020, Jeremy traveled to the Bonati Spine Institute for consultation and surgery. First, a walk across the parking lot to the on-site imaging center. Then, a meeting with the clinic staff and surgeon.
I do remember going in, they did the consultation with me, they did blood work with me. They actually did new MRIs just to see where I was at currently, because the other ones I think were about 6 months old, so they want to see if anything had changed. So the diagnosis they told me was a 2 herniated discs, my L3 and L4. So those were the ones they would have to do surgery on. When I was 20, I had the same surgery on my L4, L5 disc, but at that time I was completely knocked out. So I had no idea what was going on until after it was finished. Woke up, they actually kept me in the hospital overnight, so I had to actually stay there in a bed. It was several hours after the recovery when I woke up. They had me to try to walk around just my room, just, you know, around the bed and back. Had me lay back down. I was there for the rest of the night. After that, I had probably a good 3 months of rehabilitation therapy, which was pretty excruciating just going through that. That was pretty brutal. And after that, it was probably almost a full year before I was kind of like back to normal, feeling, you know, like I could get back to the gym and do the things that I normally did.
During the consultation, the Bonati team will explain the use of conscious IV sedation. Jeremy explains his experience with this technique during surgery.
He brought the MRI and we went over the MRI, showed me where the herniation was, discussed the surgery, what was going to happen. So that was really nice that he kind of took it step by step, explaining exactly what was going to go on, especially with the anesthesia. I was partially awake and kind of almost like in a dream state back and forth. And occasionally they would ask me questions to see how I was doing. So he kind of explained that that's how it was going to be, just to make me aware and kind of comfort me a little bit and let me know that, you know, they would keep the pain down as much as they possibly could, which they did. I mean, I don't ever remember being in pain.
In the recovery area just after surgery, walking therapy begins immediately.
Within a few minutes, the nurse, whoever was there with me, had me sit up just to make sure I could get up, let me kind of get oriented for a few minutes, help me stand up, try to get my balance, and then from there they had me walking up and down the room probably for like 5 minutes, just back and forth, doing laps back and forth. I didn't have any pain, and I believe it was only like 5 weeks after the surgery I was off my medications and pretty much back to feeling normal. I mean, I was using a rowing machine that I have here at the house. I was back in my gym working out and, you know, walking around the neighborhood doing anywhere from 1 mile to 3 mile walks. So literally I could do everything I wanted to do almost immediately afterwards. It was pretty amazing. I was back on my job doing my work that I needed to do, and, you know, I didn't have to miss any jobs or, you know, postpone them, so that was pretty nice. I was most shocked and surprised about how fast the recovery was, and I guess being out of pain so quickly after surgery. I didn't expect that at all. So to go through Bonati and literally, you know, right after surgery, not have pain, be able to get up and walk and move, and, you know, within a few weeks being almost back to normal, doing all my daily activities, was pretty exciting and amazing. Go in, get an assessment, get MRIs, and see what they can do to help, because they definitely helped me. I mean, I feel 100% better now.
Bonati was the one that helped me completely. Thank you for giving my career back to me.
He said, don't tell me, I'm going to tell you what's wrong with you and tell me if I'm correct. And so he did.
The good news this time is it was not open back surgery.
They did give me my life back.
This scar is this big.
He was a doctor that didn't want to fillet my back open like a fish.
During the whole operation, I was awake. I was talking to the doctor. I saw the operation in the monitor.
He's not really cutting muscles, he's just pushing them away.
Immediately after the procedure, I was able to stand straight again, and I had zero pain.
Well, he did the surgery on the left side, and a week later, I was back in the gym.
Don't wait until you're on that downward slide where you can't even function anymore. Just don't wait. Just get it done.
When somebody can help you to where you can recover and where you can do the things that you were able to do before, you just become thankful.
I can't thank the Bonati Institute enough for giving me my life back.
It just opens up doors that you thought were closed.
I love you, Doc.
Welcome back to American Medicine Today. I'm here with Dr. Bonati. So, Doctor, your practice has primarily been focused on the spine. However, recently, you've been expanding research into regenerative medicine. What is it about the field that truly interests you?
The medicine of the 21st century is going to be regenerative medicine and will be the 21st century and beyond.
Okay.
You need to understand that one of the problems that we have with the population today is the population require sometimes replacement of certain parts of our body.
Yes.
My alma mater is Wake Forest, and Wake Forest has an investigation on regenerative medicine going on for a long, long time. I am absolutely enamored with what is happening. In the next future, it's going to be parts of the body that are going to be replaced.
Right.
Today, we need to do transplants, and the transplants really are very difficult to get to the population that requires that transplant today, immediately. We are so behind in kidneys and lungs and hearts and livers, because require an individual who is going to donate, and also require also the fact that they need to match the donated
blood type
organ with the host.
Correct.
Well, this is going to become a passé, because regenerative medicine will bring to the world organs that they are going to be replaced immediately at the need of the patient. Now, let me tell you how that happens. When we are born, something that happens to us, that mother is going to have an organ that is being called the placenta, and the placenta is going to give to the baby food and air. So it's going to allow that baby to survive by nutrition and by oxygenation.
Yes.
But when the baby is out of the womb and the placenta is being removed, the placenta practically is being ignored. And recently we realized that the placenta is the enormous donation that the mother is going to give to this baby. And those cells that they are in the placenta, they can create organs. Those stem cells are the enormous quality and allows the body to replace organs.
Sure.
So how they do it? What they do is they have two different types of cells on the creation of the organ. One of the cells is the matrix, is the body. If you're talking about a kidney, how the kidney look.
Sure.
And that is like in a scaffold. Beyond that one, you have the cells that they're going to create the function. And right now, we are in the middle of that. We can have the scaffold, and we can use the scaffold. And those kidneys, they can be replaced, but they're not functional.
Okay.
So you have a piece of tissue that looks like a kidney, but really doesn't work like a kidney. So recently we start to see that we can go ahead and change some of that by creating stem cells, that those stem cells now they start to create not only an organ that looks like the organ that we want to replace, but at the same time start to create function.
And you're saying this all with the stem cells of placenta. You're not mixing in their 3D bioprinting, correct?
Well, the bioprinting is the enormous amount of advance that we have to be able to do that. The cells are the material that we ignore for centuries, and those cells are there.
Right.
But you need to go now use the cells in something. We develop a machine that creates a bioprinting, and that bioprinting creates now the organ.
Yes.
So we are at that stage today.
It's exciting.
And they're working on that. There's still a lot of problems with function.
Okay.
So once they are able to put the function together on each organ and then create an organ that is not only a scaffold,
yes,
but at the same time has function, then the transplant is going to be just put the organ in the body.
Oh, it'll be a game changer. No one will have to die waiting for organs. As wonderful as organ donation is, I mean, it's a loss of life, then saving other lives. But then there's all these problems with organ rejection, the medications, everything like that. And once 3D bioprinting really takes hold, there will be none of that to deal with any longer.
Exactly. That is the beauty of this regeneration medicine. And they are working very hard on it. We need funds. We need donations. So I think we need to start to think how we can afford to send to these universities X amount of dollars so these people can continue doing the research properly and advance in this field.
Think about how expensive that potentially could be.
The creation and the development is going to be expensive, is expensive.
Right.
But once you have an organ and you can reproduce, is right now then a situation that is just only use your stem cells.
Yes.
Let me tell you something though that's very important.
Okay.
For the children that they are going to be born now,
yes,
the parent, they should froze the placentas.
Keep the placenta.
And maintain a bank of those ones. So when that child is 80 years old, has replacement tissues.
It's the future.
It
it's
is.
Science.
It is. And it's all right at our fingertips now. It's exciting to think where we could be in the very near future. Unfortunately, we're out of time, and we'll have more to talk about in regenerative medicine in a future episode. Be sure to catch us next week on American Medicine Today. And if you've missed a previous episode, check us out, American Medicine Today on YouTube.
If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.